Undescended testicles are a common childhood condition where a boy's testicles are not in the usual place in the scrotum, and in this video we're going to cover how common it is, causes, diagnosis, and finally treatment. Now, in terms of how common undescended testicles are, it's estimated that around 1 in every 25 boys is born with undescended testicles. Now, in most cases, you don't need to worry too much because the testicles usually move down into the scrotum naturally during the first 3 to 6 months of life. However, around 1 in 100 boys do have testicles that stay undescended unless they get treatment. Now, the medical term for this is unilateral or bilateral cryptorchidism, depending on whether one or both testicles are affected. Now, undescended testicles are usually detected during the newborn physical examination. This is usually carried out soon after birth or during a routine checkup at 6 to 8 weeks. Now, if you notice that one or both of your child's testicles are not in the normal place within the scrotum at any point, then it's a good idea to see your doctor. Now, whilst undescended testicles typically aren't painful and your child isn't at risk of any immediate health problems, it's important to monitor the condition in case treatment is needed later on. Now, during pregnancy, a baby boy's testicles form inside his abdomen. They then move slowly down into the scrotum at about a month or two before birth. Now, why some boys are born with undescended testicles is not exactly clear, but most boys with the condition are otherwise completely healthy. However, being born prematurely, so before the 37th week of pregnancy, having a low birth weight, as well as a family history of undescended testicles might increase the chances. Now, diagnosing undescended testicles is usually straightforward with a physical examination. This helps to determine whether the testicles can be felt near the scrotum or if they can't be felt at all. Now, sometimes this examination can be a little bit tricky, so your doctor might refer your child to a paediatric surgeon. Now, if on this occasion the testicles can be felt, then no further scans or tests are typically needed. But if they can't be felt, then part of the initial treatment might involve keyhole surgery to see if the testicles are inside the abdomen. Now, if the testicles haven't descended by 6 months, they're very unlikely to do so on their own, and treatment will usually be recommended. Now, this is because boys with untreated, undescended testicles can face fertility problems later in life and a slightly increased risk of developing testicular cancer. Now, treatment typically involves an operation called an orchidopexy to move the testicles into the correct position inside the scrotum. Now, this is a relatively straightforward operation with a very good success rate. Surgery is ideally carried out before 12 months of age, and that's because if undescended testicles are treated early, the risk of fertility problems and testicular cancer can be reduced. Now, the operation involves making a cut, known as an incision, in the groin to locate the undescended testicle. The testicle is then moved downwards and repositioned in the scrotum through a second incision. Now, if the testicle is higher in the abdomen, then a type of keyhole surgery known as a laparoscopy might be used to locate and reposition it. This involves passing a laparoscope, which is a small tube with a light and camera, through a small incision in your child's abdomen. Now, a testicle that is found inside the abdomen can sometimes be brought down into the scrotum in a single operation, but in some cases this needs to be done in 2 separate stages. There is a small possibility that there may be no testicle at all on that side if it didn't develop properly or if it twisted and withered away early in life. Now, this would be confirmed during the operation. Now, when the procedure is complete, the incisions are usually closed with dissolvable stitches that don't need to be removed, but again, it's worth just checking this with your surgical team. Orchidopexies and laparoscopies are typically performed under general anaesthetic, which means that your child will be asleep and they won't feel any pain during the procedure. The operation will vary from person to person, but it normally takes about an hour or so, and it's usually done as a day surgery so your child can return home on the same day. Now, after surgery, your child might feel a little bit unwell for the first 24 hours due to the anaesthetic. This is normal. Now, to help speed up recovery and reduce the risk of complications, they'll need regular pain relief for a few days. Engaging in activities like playing games, watching TV, and reading together can help keep their mind off the pain, and it's also important to encourage your child to drink plenty of fluids. Their groin area might feel sore for a little while, so wearing loose-fitting clothing will help, although wearing a nappy and supportive underwear is fine and can protect the area. Otherwise, it's important to follow your surgeon's advice about washing and bathing, and it's best to ask them what they advise on this. Now, your child should avoid riding a bicycle or using sit-on toys for a few weeks to prevent the testicles from moving back up into the abdomen, and resting at home for a few days before returning to school or nursery is also recommended. Now, it's also important to monitor for any signs that the surgery site has become infected. Now, these include severe pain not relieved by prescribed pain relief, a high temperature or feeling hot and shivery, redness, inflammation, or warmth at the surgery site, as well as discharge of fluid or pus, which is a yellow or green-like material that might have a bad smell to it. Now, if you notice any of these signs, it's important to contact your doctor or the surgical team for advice. Now, as with any surgery, an orchidopexy carries some risks which might require further surgery to address. Possible complications can include bleeding, swelling, or bruising at the incision sites, infection, the testicle moving up into the groin again, the blood supply not sustaining the testicle in its new position, known as testicular atrophy, and damage to one of the tubes, making it difficult for semen or sperm to pass through. Now, generally complication rates are low, with the main risk being testicular atrophy. For more information on this procedure and condition, please do check out the trusted resources in the description box of this video.